A healthier, happier life begins here. Welcome to Mercy Moments, a podcast by Mercy Health in association with True Chat.
Did you know that as it applies to healthcare, communities now have what are referred to as community educators? CEs help people get the information that they need for things like health screenings, point of care service, and other healthcare related services. In fact, CEs are an important part of many functions throughout the community. Thank you for tuning in today. I'm your host for Mercy Moments, Terry Allen Ceyler, coming to you from Champaign County here at True Chat Studios in Urbana, Ohio. I'd like to thank my guest today, Tonya West. Tonya, welcome.
Thank you, Terry. It's a pleasure to be here with you today.
So for those that don't already know, Tonya actually has been an integral part of the community for many years. For several decades, she served as the Director of Resident Services at the McCully Center, and she currently is a member of Champaign County Board of Directors. Now she's taken on a new role as the community organizer at Mercy Health Urbana Hospital. So, Tonya, professionally speaking, is there anything else that I left out?
No, I think you've covered me well.
So tell us a little more about your upbringing and how you became such an important part of the community.
Well, I was very fortunate to grow up right here in Urbana. I was raised in a family that embraced paying it forward and giving back and always making a difference somehow every single day in somebody's life. I knew at a very young age, after experiencing hospitalizations right here in Urbana, that I wanted to grow up to be like the person that came to my room and made me smile. And that's what I pursued. I'm a local girl here from Urbana who pursued a degree in social work. And I've had several opportunities to listen to people and what their needs are in my various roles. I've been an advocate for the Ohio Youth Commission. I've been a head teacher at Head Start. I've been a case manager for Longview Industries. I'm a certified activity director, and I also worked admissions and discharges in our community.
So what was your first role in the community? How did you get started?
My very first role was working at Head Start with children.
I see.
So I had levels of responsibilities and transportation and teaching, home teaching families.
Right.
How to take care of their children, how to cook, and all the services they might need. So that started my ability to know what our community has to offer.
Right.
Because I had to search for those things. So I've spent a lot of my career connecting the dots for people to their resources that they need.
Right. That's how you that's how you create value in a community, is people connecting their dots like that. So, so what are some of your hobbies?
Some of my hobbies, I love to grow flowers and plants, but I get more joy out of that hobby by giving those and paying them forward to other people. I love to take pictures and photos of different abstracts, and I just like to be creative. And a real hobby that I love is event planning and decorating. So
what is your favorite thing about Champaign County? I mean, everybody has something. Like for me, it's the food bank. It really speaks to me. They do a great job. I mean, I grew up in Piqua and moved to Dayton and live in Fairborn, and a lot of these places are only open a couple of days a week. I mean, the food bank does an awesome job of providing care. So what do you like most about Champaign County?
I'm very proud of Champaign County, and I look at the opportunities for volunteerism, how our community takes care of one another, the resources that are available, all of the opportunities that this community offers to people.
Right.
In healthcare services and whatever you need, there is somebody here that's going to be able to help you.
That's the first thing I noticed when I moved into the community, that it's maybe because of the location, it's far enough from Dayton, it has its own feel and flavor, and they go all out.
Right.
I mean, a lot of that's based on resources, of course, but you just get a different feel here. Like they really want to apply, their interests. So,
well, and when you look around at all the attractions to go to in our area and how people do give back, I think that that's something that just resonates very closely to people's hearts about our community.
Right. So how do you see the community educator role? I mean, there's different flavors of that. Every county has their own educator, and they do it a little different. But how do you see that role?
I see myself as the coordinator of the program, that I'm going to be working on developing programs and materials and events that will teach people about healthcare topics.
Right.
I would like to teach people how to manage their existing health conditions and the services that are available.
Right.
And to help people find the service that they need. So many times people might not know that the service is available in our community.
Well, plus you can leverage that connection you have to the community. Mm-hmm. I think people sometimes get the community paramedic and the community educator confused.
True.
I really do. You're more of the face of Mercy in the community, where the community paramedic does more of the nuts and bolts in providing point of care service. But your role is equally, or if not more important, in that you're really the face and you're the glue person. So,
and the beauty of that is that we will always collaborate together and to know what the resources are and to help all the individuals that we come across. And my position's also about collecting and analyzing some data that we can reach out and see what the needs are in our community. I really like to advocate for improved healthcare services and policies that promote health care in our community. So I'm looking forward to moving forward in this position.
So where are our listeners most likely to find you out in the community?
Everywhere.
Right.
I try to manage everything that I can go to. There's so many community events. There's school events, there's auxiliary functions, there's fundraisers, there's ribbon cuttings, there's dedications. And I like to be wherever I can help somebody. That's a true passion of mine, is if somebody has a question or they need to know a direction to go to, I want to give them that resource.
So you do have a physical location, though. Where is your office exactly?
My office is located on the second floor of Urbana Hospital. And what's really interesting is many years ago, I did my student social work internship there. And when they took me to the office, when I got this new position, it's at the same exact office that I started in the 1970s.
Wow.
So, and the office is still there. When I walked in, it made my heart smile because I remember all of the brochures and all of the connections that I made with people back then.
Right.
And then the other thing that I love about the second floor is growing up in Urbana, my mother would tell me to stand on the chair and look out the window towards the hospital. And at that time, they delivered babies. And she always told me that when that light's on the second floor, you know there's a new life.
Wow.
And to say a prayer for that baby. So to this day, all these years later, at nighttime, I always glance at the hospital window, knowing those babies aren't there, but it's just a good memory. It's a history.
Right.
And I know many people in Urbana can relate to that.
So what's a good contact number for you?
Anyone is welcome to call my phone, my office phone. It is 937-484-6217. And they could also reach me by email, which is tewest@mercy.com.
Typically, what type of functions do you attend?
I attend functions, like recently I attended a function on Labor Day at the YMCA with the 5K that they had completed, and I was able to provide information, resources, meet several people. We provided lunch for the Freedom Grove event on last Friday. And anytime that we have an opportunity to make a difference and to be present, I want to be at.
Right,
so,
exactly. It's like we talked about earlier, connecting those dots
yes.
and kind of being a bridge.
Right.
Not just in healthcare, but the various functions in the community.
Right. Because there's so many opportunities, and when you see the value and when you listen to people, then you know that you've you've helped them.
Right.
And that's what I want to do. I want to be a great resource for everyone in our county.
And we talked about this the other day. Out of all the things that you can do and the skills that you have in healthcare, if people don't have the sense that you care, then they're just going to tune you out. So in healthcare, you have to care.
Yeah.
You have to care. If you don't care about people and you work in healthcare, you're in the wrong business because it's a caring profession. So
my caring is about networking and listening, truly listening to what people have to ask and say.
Right.
So it's about relationships.
We would like to take this time to remind our listeners that all of True Chat's podcasts help pursue a common goal: to educate people by providing honest, open, and respectful conversations and information. To learn more about Mercy Moments, listen to the recap at the end of the program. And to find out where you can listen to us or engage with our program, please visit us at mercymoments.org. Welcome back. So just to recap, our conversation today has been about the Community Education Program, and my guest today has been Tonya West. Tonya, welcome back.
Thank you.
So Tonya, in your own words, describe exactly what you feel the impact's going to be on the community.
A few of the goals that we have planned and that I want to work towards is to make people more aware and get them involved in preventative health care, such as lung screenings, breast screenings, etc. I'd also like to introduce the community to services and other resources available to them and to create a functional working relationship with all the other services in the community. It's very important that I have a relationship with the community paramedic, the fire department, etc., and also to educate all prescribers.
Those are good points because especially in regards to the screening programs, we've done really well with that. We started off with Breast Cancer Awareness Month, which, by the way, is next month. And then we followed that with lung screening month, which is typically in November. But we have had a pretty good response from that. But it took getting out in the community to make them aware of that resource because there is a value there.
Definitely.
So Tonya, what is one thing that you feel the county already does well?
I feel that the county does very well with community involvement. There's many opportunities to serve others and to reach out. I think the volunteerism, I think just sharing information about the community and trying to get people involved. But I really feel that our community is very good at giving back to try to help in whatever need we can help.
Right. So what's one area do you think that can still be improved? Like for me, it's, even though we do a great job of addressing the needy, as far as making sure that they're fed and they have a place I think there's always room for improvement. There's always going to be homeless and there's always going to be people that need this or that. But I think there's always room for improvement. I mean, you'll never get to zero, but I think that's where we can improve. So for you, what's one area of the community that you think we can make an impact and continue to improve?
For my position, I really feel strongly about reaching out to whatever a family or a person is going through, whether it be addiction or, like you said, homelessness or mental health or whatever issue that is facing someone, that we reach out and strive to help, to make a difference.
And that's really the problem. I mean, sometimes there's a tendency to have siloing go on, where, we do our thing, the fire department does their thing, the police department does their thing, and it's working together that really makes an impact. And, the longer you work in healthcare or in whatever, you eventually figure that out, that you're not an island to yourself. And sure, you can make an impact on your own, but you make a greater impact when you work as a team.
Right.
So.
And having the community involved in just knowing with Mercy Health and Urbana Hospital, the mission that we have and that we exemplify that in our community.
That's a good
services.
Point. That's a good point because without community engagement, we wouldn't get the donations that we need to feed the hungry and house the homeless and things like that. So, yeah, you have to get, and that's kind of what these podcasts do. We don't just want this to be an infomercial on Mercy Health. We want people to understand we are a member of the community. We've been here for a long time, and especially in the last couple of years, we've put a lot of infrastructure into the community. I mean, I could go on and on and on, from from physical renovations of the hospital to adding services to adding equipment. I mean, millions and millions of dollars. And we don't just do that because, we want to make money. It's because we really do care about the community and want to see it prosper and grow. So.
And look at the change that everyone saw with the front facade at the hospital.
Right.
And the drive and how beautiful it was during the holidays and the green and the blue lights, and everyone commented, and that makes a difference.
One of my favorites is actually Veterans Day. Bob and all them put those flags out front. It's amazing. Like, they can do that in just a few hours. I'm like, dude, you must have done that like 50 times, because you can literally put out hundreds and hundreds of huge flags in an hour. So it's amazing.
It is amazing. And what I always look at is, how did we make a difference with what we did?
Right.
And when you touch one life, it's worth making that difference.
And it's like the butterfly effect, you know, and you learn this with age too, with wisdom, that the seeds that you sow now might only bear fruit years from now. But it's just making a positive impact and being consistent about it. So, many leadership gurus would tell you that the three things you need to be in life is consistent, persistent, and have the right attitude, and you can be successful. But with some of this, you might take as many steps back as you take forward. But if we just stay on course and do the right thing, it'll all work out.
Well, when you think about legacies, someone's legacy is to be there and be present, listen, and to make a difference. And I think that's what we do.
Right. I would like to thank my guest today, Tonya West, for being here. You can listen to Mercy Moments on Spotify, Apple Podcast, and Stitcher, and anywhere else fine podcasts are found. You can also listen to us at mercymoments.org. For Mercy Moments, Mercy Health Urbana Hospital, and True Chat, I'm your host, Terry Allen Ceyler.
And I'm Tonya West, your community educator for Urbana Hospital.
Thank you for listening today, and stay healthy, Ohio.